Hope you all are having a great time and enjoying the new topics and slides every Sunday. We are posting it for you guys. And today we will talk about the adverse donor reaction. So before going into the topic, let's see what is the adverse donor reaction. It's an untoward feeling by the blood donor. It can happen before, during, or after the donation. Or we can say it's a sign or a symptom of the donor discomfort that is unfavorable, unintended, and severely enough to either warrant the donor or someone else calling for attention of the blood bank staff or what is noticed by the medical officer. There is a psychological element to most of these reactions. So, a friendly, cheerful atmosphere at the donation area will help the donor to remove this anxiety and prevent the adverse reaction. So as we all know that the prevention is better than cure, so the medical officer should be trained to recognize and give initial treatment including the CPR. Emergency equipment should be very handy. These include your MS's bowl, oxygen mask, emergency drug. And there is immediate action. When a donor is having a reaction, first you have to remove the tourniquet and the needle. Take the donor to the safe place or you can use the screen so the other donors won't get affected from it. And then you have to notify the donor physician. Do the regular checks for the expiry of the drugs. It includes syringes, needle, IV set, IV fluid, IV steroids, antiemetic, calcium gluconate, adrenal or NORAD, ammonium, ambu bag, and oxygen cylinder. So as we all know that the adverse donor reaction is majorly divided into two parts, which is the local reaction and the systemic reaction. So the local reactions can occur because of the problem in the puncturing the vein. So this can include pain, thrombophlebitis, hematoma. Whereas systemic reactions, these include the syncope, nausea, vomiting, convulsions, and tetany. Next one is your what is the difference between the local reaction and the systemic reaction? The local reaction predominantly occur because of the problem related with the venous access. So they can be hematoma due to extravasation of blood from the veins, or it can cause by the incorrect placement of the needle during the venipuncture. This can lead to pain, hyperemia, swelling mainly develop at the site of the extravasation. Other local symptoms can be pain due to slight trauma. In most cases, however, these are like basic complications which doesn't require any treatment. Local phlebitis and the thrombophlebitis are the more serious complication that can occur but very rarely. In systemic reaction, these are the vasovagal reaction. They can be triggered by the pain at the venipuncture site or when the donor sees another donor that donor is having the anxiety or reaction, or when the donor sees his or her blood, or when the donor is not unwell. So these reactions can be characterized by the appearance of pallor, sweating, dizziness, GI disorders, and may require the therapeutic intervention for the treatment of these type of reactions. So vasovagal reaction, this is a hypothalamus response mediated either by the central neural pathway or peripheral pathway associated with the baroreceptor. So vasovagal reaction originating with the stress-induced elevation in the pulse and the blood pressure followed by the sign and symptom of fainting. Clinical characteristics like sweating, cool extremities, slow or faint pulse, low blood pressure, vomiting, or rarely fecal or urinary incontinence can be observed, and there can be loss of consciousness, convulsions can be seen. So these symptoms occur due to the sudden fall in the blood pressure and the dilatation of the arterioles. Then how we can manage this? So we have to place the donor in the Trendelenburg position. You can put the ice pack or the cold towel on the donor forehead or the neck, back of the neck, or you can tell the donor to breathe in the paper bag. Then how you can prevent it? By asking the donor to have water before the donation, as water ingestion has a pressure effect, which will enhance the tolerance of the upright position by increasing peripheral vascular resistance and reduce the chance of syncope during the orthostatic stress. Pathophysiology of such reactions. So, pre-syncopal phase, stress induced that can lead to increase in the heart rate and the blood pressure, which can lead to the vesicular dilatation and bradycardia. Then hypothalamic response, which is mediated by the central neural pathway, and the emotion directly affect the brain, which is stimulated by the hypothalamus. These lead to inhibition of medullary cardiovascular centers and the peripheral neural pathway, which is mediated by the baroreceptor. Then vasovagal reactions are mild, moderate, and severe. So the mild reaction can be encountered as nervousness, hyperventilation, nausea, with or without vomiting. So what you have to do, you have to stop the donation first, loose the tight clothing of the donor, improve the ventilation, Trendelenburg positioning of the donor, hold compresses, ask the donor to breathe in the closed bag, and do not leave the donor unattended. Then moderate, it can be transient loss of consciousness, bradycardia, hypotension, and how you can treat that. Similarly, as we have treated the mild reaction, use the screen to separate the donor from the other donor. You can administer 95% oxygen, 5% carbon dioxide, and check the vitals of the donor. And the severe reactions include marked hyperventilation, tetany due to hyperventilation, stiffness or tingling in the fingers, anxiety, and convulsion due to ischemia. How you can treat this? You have to ensure there should be adequate airway. Gently restrain the donor to prevent himself or herself from injuring. Make the donor lie in a lateral position to prevent any aspiration. Call for emergency for the help. Why these can occur? What are the predictive factors? Predictive factor when a donor is in a younger age group, a donor is a female donor, first time donor, the donor weight is very low, the donor is fatigued or having the lack of food, sleep, or it is happening in an extreme temperature where humidity is more. Then local symptom includes your hematoma. Hematoma is accumulation of blood in the tissue outside the vessels. Symptoms include bruising, discoloration, swelling, local pain. And how we can manage if it's the immediate case. Then you have to stop the donation, deflate the cuff, remove the needle, press that vein punches site for at least 7 to 10 minutes by keeping the gauze piece over it. Then you can apply the ice on that area for 5 minutes. If it is a delayed one, then use the ice compression and analgesics. Keep the hand in rest. Observe and inform the donor regarding the compartment syndrome, and if necessary, refer it to the surgeon. What is the outcome? It is generally resolved within 7 to 14 days. Please do not prevent these donors for the further donations in future. Then puncture of the artery. Arterial puncture is a puncture of a brachial artery or one of its branches by the needle used for bleeding the donor. It is a rare complication which can be observed when there is a fast flowing of bright red blood is there. There is a risk of large hematoma is increased, like if the things get very manipulative, like the donor is having the compartment syndrome in the forearm, then if while puncturing you make such puncture that the brachial artery pseudoaneurysm can be formed, or there can be arteriovenous fistula, or there might be delayed bleeding can be observed. Although these are very rare but can happen. To stop the donation, we have to apply the pressure, raise the arm above the heart level. Then the pressure at the venipuncture site to be applied for at least 15 to 20 minutes, and we have to reassure the donor. Nerve injury, these are the cutaneous branches of the median and ulnar nerve which can be injured occasionally by the large bole phlebotomy needle. These can directly damage the nerve from the phlebotomy, but is not very common. Injuries are generally transient and rarely a source of donor distress. Injury of a nerve by the needle is occur when we are inserting the needle or when we are withdrawing it back. So symptoms can be there will be immediate severe shooting or the radiating pain. This is the earliest presentation which you can observe in the donor facial expression or the donor will tell. Then sensory changes in the forearm, wrist, hand can be seen. 70% of the nerve injury usually disappear within a month and almost all resolve within 1 year. Rare cases of complex regional pain syndrome has been reported. How we can prevent it? To reduce the risk of direct nerve injury, need to be monitored. You can go with the single prick strategy. Thrombophlebitis is the inflammation in the vein associated with the thrombus. This can be mild phlebitis in the venipuncture site, very common, self-limited, and usually of little consequence. Symptoms can be seen. There is a warmth, tenderness, local pain, redness, and swelling. It is a superficial vein that will give rise to the subcutaneous red heart and tender cord. And the thrombophlebitis is a deep vein, give more severe symptom as may be associated with the fever. Complication, although it's a benign appearance, but it can lead to local abscess formation and septic phlebitis. So what we can do? We have to give oral analgesic, anti-inflammatory agent. We have to administer oral antibiotics and give warm compression. Allergies can be happen with the uh, sanitizers or with the iodine, betadine, which we are using to clean the vein puncture site. So symptoms can be seen like difficulty in breathing, wheezing, hypertension, tachycardia, bradycardia, facial swelling, flushing, burning eyes, etc. Even anaphylaxis can may happen. So you have to give antihistaminics. Hyperventilation, it's the increased inspiration and expiration. Either the rate or the depth of the breathing can increase. It's result the excessive loss of carbon dioxide, which can lead to hypokalemia, tetany, and syncope in severe cases. How you can manage? You can either give the injection of calcium gluconate, you can either give the tablets. It is generally associated with the anxiety. How you can prevent it? So, reassurance to the donor is very important. Ask the donor to cough to interrupt the pattern of breathing. Instruct the donor to rebreathe expelled air in the small paper bag. Convulsion. True convulsions are very rare, so how you can prevent it? Prevent the donor from injuring himself herself. Make the donor to lie in the left lateral position. Place the tongue blade between the teeth to prevent the biting the tongue. Ensure adequate airway. Cardiac problem, serious cardiac problem, extremely rare in the blood donor. If the donor is in cardiac arrest, then we have to begin with the CPR and continue until the medical aid arrives. The nature and the treatment of all the adverse reaction should be noted down as we are having the donor hemovigilance program in India. So we have to notify every adverse reaction in that program. So that's all for today. Thank you so much. Kindly like, share and subscribe the video.